In this presentation, I'm going to go over our first area of injury, the foot. The foot is designed to absorb forces and to provide support during walking, running, and jumping. There's no surprise that there's a lot of injuries that's happened to our feet. So we'll start with all our body parts. We're going to work our way up to the body, through the body, with some basic anatomy. This is not an anatomy class, but you need to have some foundation of the anatomy to understand it. I'll primarily in this course focus on bones and some other parts of the body. I'll talk about some muscles and ligaments and tendons, but for this particular body part, I'll start off with bones. So each one of our there's 26 bones in each foot, or 52 bones in the feet. We have 14 phalanges. Those are your toes, and you can see in the picture that in the big toe, or the first digit, the daddy toe, the great toe, you have 2 phalanx, and then the other 4 toes you have 3 phalanx. So that's how you have 4 phalanges. Then the long bones in your foot are called your metatarsals. So you have 5 metatarsals. And just so you know, we start numbering our toes, starting with our big toe. That's our phalanx number 1, or number 1, great toe. And then we go 1, 2, 3, 4, and 5. So our little toe is the 5th phalanx, or the 5th metatarsal, if we're counting our metatarsals. And then we have 7 tarsal bones. Those are what makes up your foot. They are 3 cuneiforms. You'll see on the picture we have lateral, intermediate or intermedial, and medial cuneiforms. We have the cuboid, navicular, talus, and calcaneus bone. The calcaneus is the heel bone. That's the one you can think about in your heel. Okay, then we have arches in our feet. So the arches assist in supporting our body weight. They're like our shock absorbers in our feet. They provide spaces for all the blood vessels and nerves that go from the back of by your heel all the way to your toes. And they are created by different ligaments and bones in our body. So we have 4 arches in our feet, or in each our foot. In B on the picture there, you have your first one is the medial longitudinal arch that goes from your medial border of the calcaneus and extends forward to the distal head of the first metatarsal. This is what you would normally think of the arch in your foot. We'll talk about issues with our arches in just a bit. Our next arch is the lateral longitudinal arch. That is C in the picture. So this is on the lateral side of your foot. And it runs again from your calcaneus to the base of your 5th metatarsal. It is not as high as the medial longitudinal arch, so it's harder to see when you just look at somebody's foot. Then our next arch is the metatarsal arch, which is on A of this picture. And it's located at the distal heads of the metatarsals. So that's towards your toes. And stretches from the 1st to the 5th metatarsals. And then our final arch is the transverse arch, and it runs across from the cuneiforms to the cuboids closer to your heel if you're looking at a person's foot. Next area that we're going to talk about in our feet, or part of our anatomy of our feet, is called the plantar fascia, and it's just a bunch of tissue that runs from your calcaneus or your heel all the way to your toes. So that's just a general area, but there is, and you can see in that picture, the plantar fascia is pretty thick tissue. We're going to talk about plantar fasciitis in a little bit. That's why I want to tell you what that particular area is. And our next area of anatomy is foot joints. So we have two main types of joints in our body. Again, a joint is where two bones meet, and then we have range of motion in those joints. The first one is the interphalangeal joints of our toes, and we have the DIP and a PIP, which is the distal interphalangeal joint. That's the very end of your toes where they move. That would be flexion extension. Then we have the PIP, or the proximal interphalangeal joint. That would be the second area of that, or your knuckles of your toes. And again, we have flexion extension here in our toes. Then our next foot joint is the metatarsal phalangeal joint, or the MP joint. And this is where the phalanges and the metatarsals meet. Here we have abduction and adduction, flexion extension in our toes. And our third joint is the subtalar joint. This is between the talus and the calcaneus. This is typically what we think of as the ankle joint. This is where eversion and inversion happens. So that's our joints in our feet. Now we're going to move on to different conditions. They're not really injuries. They are just different types of issues that can happen in the feet. The first one we're going to talk about is Pes Plantus, also known as claw or hollow foot. This is high arches. What I like to tell people, if you know you have high arches, is when you get out of the pool, you take a step and you can't see your entire foot. You just see your heel and your ball of your feet. And you have a big gap, so you have a high arch. And how we typically take care of somebody with high arches is with orthotics or our arch tape job, which you're going to be taught how to do in this class. Orthotics are things that you put inside your shoes that are either you can buy them off the shelf, or you go to an orthotic specialist and they make things that are designed specifically with your feet, for your feet, that are going to help with various issues at your feet. Next issue is called subungal hematoma. This is runner's or tennis toe. As you can see in the picture, it's blood underneath the nail. And typically, if you're not trained in how to do this, you won't do this particular procedure. Your doctor or a podiatrist will typically do this. They'll drill a hole in your nail using a specific nail drill, which will cause the blood to come out from underneath the nail and relieve the pressure. Then you really need to make sure that's cleaned and that it's bandaged. It is very painful. Pes Plantus, which I should have probably had over Pes Cavus, is flat feet or little or no arch. As you can see in the picture, that person has no arch at all. The foot is, again, if you're using the pool, come out of the pool, take a step on dry land, you see your complete foot. You shouldn't see your complete foot like that. That's Pes Plantus. And the treatment for this is, again, orthotics or our tape job, our arch tape job. The next condition is called bunions. As you can see in the picture, we have some kind of growth at the head of the first metatarsal. This is called exostosis. So the first metatarsal head becomes enlarged, which leads to the first toe being displaced laterally. So the toe moves, the great toe moves outside or laterally, and this deformity is called hallux valgus. This can be genetic in nature, or this can be caused by wearing really narrow shoes, and I have Nike in there because I think Nike makes really narrow shoes. Now bunionettes or tailor bunions are our next condition. This is at the fifth metatarsal versus the first metatarsal. So now the great the first toe is displaced inside or medially, as the picture shows. And our treatment for our bunions or bunionettes are to wear proper shoes. You need to make sure your shoe around your toes is wide enough for you. Also, the padding. I show a picture of padding there, and sometimes you have to have surgery with a bunion or a bunionette. That should be your last option if you can possibly provide or avoid it. Next area is ingrown toenail. As the picture shows, you have a inflammation because the toe nail is actually growing into the skin, and it's causing the skin to be inflamed. You see the redness, and you have inflammation and swelling. Some ways to take care of this particular issue is to cut a V in the nail right in the center of the nail that causes the nail to grow towards the center. Soak the toe or the foot in warm water and place gauze underneath the nail. That helps lift out the nail. I've had to go to a podiatrist to remove that part of the nail because it's so painful. This can be a very painful condition. Some ways that you can prevent any foot injuries is wear proper shoes, just like I was talking about earlier. Sometimes your shoes don't have the correct arch support. You have too narrow shoes, and those can all lead to foot injuries. Orthotics, again, is another way to prevent foot and other body parts. We're going to talk about this throughout this class. Orthotics is one of the ways that we prevent a lot of injuries, or especially chronic injuries. We want to strengthen and stretch our lower leg and foot muscles. That typically would be the Achilles stretching or the calf stretching, those type of things. And proper hygiene. Wash your feet. Some of the things that we see in foot injuries can be, I didn't put in there, foot fungus and stuff like that, so wash your feet. All right, the last part of our discussion is going to be on actual injuries to the foot. First one is contusion, which is a bruise. It happens quite a bit in athletics because somebody can get stepped on, kicked on, some kind of direct blow, and drop something on your foot, as the picture shows. The first thing we got to do is rule out. That's what R/O means. Rule out. FX means fracture. Got to rule out a fracture when we have a contusion. We do what's called a tap test, where we take the toe, we tap it with our finger to see if that's causing a lot of pain, to make sure we don't have a fracture. Sometimes we have to send them to get an x-ray to make sure they don't have a fracture. Some of the main sites that somebody can have a contusion is at the medial longitudinal arch, the calcaneus, or the heel, the top of the foot, and the ball of the foot. Our signs and symptoms for every single injury, we're going to have the signs of inflation: pain, swelling, and point tenderness, especially for a contusion. In our treatment for pretty much all injuries in this class is going to be price, protected, rest or restricted activity. I is for ice, C is for compression, E is for elevation. And the way we're going to protect this particular injury is do some kind of padding for that injury. Our next injury is turf toe. This is a sprain of the great toe, as the picture is showing, and it's caused by hyperextension of the great toe. Typically, why it's called turf toe, because back in the 70s, they came out with a new product called AstroTurf, and that AstroTurf is basically, the early AstroTurf is really thin. It was basically, the athletes were playing on concrete with a little bit of green turf on it, and a new injury started with turf toe because an athlete would step down or push off, and it would cause the stretching of the ligament of that held the great toe in place. So a lot of pain when anytime somebody pushes off on the great toe. We have decreased range of motion, or ROM, and decreased strength. They can't push off their toe at all. So that's the turf toe tape job is what you're going to be taught in this class. The other one is orthotics. Again, stiff-soled shoes helps provide some support. And there are some other turf toe straps and specialized things that can also be used. Rest, which is not what we want to hear in athletics. Another common injury in the foot is fractures. One type of fracture is called Jones fracture, and this is a fracture to the head of the fifth metatarsal, which I'm showing in the picture there. This can happen a lot with ankle injuries. This typically happens with a direct blow, with inversion and plantar flexion, or overuse. Anytime somebody sprains their ankle, we have to rule out a Jones fracture. So they have immediate swelling at the fifth metatarsal and pain, point tenderness, right at the head of the fifth metatarsal. Our treatment here is to immobilize, get the doctor, because we got to get it x-rayed to see if there's a fracture. And then from there, we figure out what to do after that. Stress fracture is common at the metatarsals and navicular. Typically what happens here this is a typical cross-country injury. The athlete changes their workout or their shoes. They have either increased their mileage, changed more hills, or doing something different in their workout. Then they all of a sudden slowly start getting pain, or they have no pain until they step down. That's called pain with weight bearing. And our treatment for the stress fracture is they have to go see the orthopedist doctor or the foot specialist, do MRI or CT scan to see if they can see the fracture. I mean, fractures take anywhere from 6 to 8 weeks to heal. If you're younger, it takes less time. If you're older, it takes a lot more time. Okay, our next injury is plantar fasciitis, which is the inflammation of that plantar fascia. It's a very difficult injury to take care of. This is really a catch-all term for any pain at the proximal arch and heel. Again, this is a very difficult injury to provide care for. This can be caused by leg length discrepancy. So you have one leg that's longer than the other. You can have Pes Plantus or Pes Cavus, tight Achilles, and a common combined with overuse. So this is a pretty common injury in athletics. So our signs and symptoms for plantar fasciitis: we have pain at the anterior and medial heel, pain on weight bearing at the beginning of the activity or beginning of the day, which decreases during the activity. So that means it starts feeling better when it warms up. They have pain right when they wake up. They have pain when stretched in dorsiflexion, and or pain, it feels like they're standing on a rock. So these are pretty common signs and symptoms for plantar fasciitis. Our treatment for plantar fasciitis is orthotics, again, heel cup, which is just a padded heel that you put on the heel because a lot of the pain is in the heel. We have to do stretching for the plantar fascia, a lot of it. Sometimes with this, if they see an orthopedic doctor, they may do a cortisone shot, and for real extreme measures. Athletes have had their plantar fascia removed. I mean, that's real extreme. So the arch taping tends to help with this too. So that is our last injury in the foot, and I hope you have learned a lot about foot injuries.